How does scrupulosity manifest in non-religious contexts? Imagine feeling constantly worried about whether your actions are morally right or wrong, even when there's no religious belief involved. That's what non-religious scrupulosity, also called moral obsessive-compulsive disorder, looks like. Instead of religious sins, it revolves around secular ideas of morality and ethics. People with this form of OCD experience intrusive, distressing thoughts about their integrity, honesty, or social responsibility. They might obsess over whether they said something hurtful or did something wrong, even when there's no evidence to support these fears. These doubts can become so persistent that they interfere with daily life. Individuals often develop compulsive behaviors to try to reduce their anxiety. For example, they might repeatedly review their decisions, mentally replay conversations, or seek reassurance from others about their morality. Some might avoid situations they see as morally risky, like certain social interactions or decisions that could be judged negatively. These compulsions are driven by a need to neutralize or prevent perceived moral failings. They might also engage in mental rituals, such as mentally reviewing their actions or mentally covering all bases, similar to religious prayers or rituals, but without any religious context. A key feature of non-religious scrupulosity is an excessive concern with personal integrity. People become preoccupied with being a good person according to their own standards or societal expectations. This preoccupation can become rigid and overwhelming, leading to anxiety and distress. Even without a religious framework, the fear of doing something morally wrong can feel just as intense. The person might constantly worry, "What if I am wrong?" And this doubt erodes their confidence in their moral judgment. Reassurance-seeking is common. They may ask friends or family for validation about their actions or repeatedly check their behavior to ensure it aligns with their moral standards. Sometimes, they engage in mental checking, reviewing past decisions or imagining worst-case scenarios. Despite having no religious beliefs, they might also perform behaviors similar to prayer or ritualized thinking to try to feel morally clean. These compulsions can take up a lot of time and cause significant distress, making it hard to focus on work, relationships, or daily routines. It's important to understand that this form of OCD is a clinical anxiety disorder, not a spiritual or moral failing. It's driven by obsessive thoughts and compulsive responses, which are characteristic of OCD. The content of these obsessions revolves around secular morality, personal integrity, and social responsibility, rather than religious rules or sins. Treatment typically involves cognitive behavioral therapy, especially exposure and response prevention, which helps individuals confront their fears and reduce compulsive behaviors. If you or someone you know struggles with these symptoms, seeking help from a mental health professional can make a significant difference. Remember, everyone's experience is different, and effective treatment is available to manage these distressing thoughts and regain peace of mind.